What are we going to talk about today? We're talking about staying healthy and avoiding muscle pain, muscle soreness that can happen as a result of activity. If you work out, you've probably experienced muscle soreness to the point where it's a little bit debilitating. This can happen with kids as well. Now, there is an obesity epidemic that is currently going on with inactive kids or sedentary kids. However, the kids that we work with are highly active and very active often. They're going from practices to workouts, active in their PE in schools, doing outside activities other than sports, doing performance training sessions, and all of that leads to muscle soreness, muscle pain, and hopefully not, but can lead to muscle injury or muscle breakdown. So we want to talk about our favorite methods today about preventing muscle soreness, muscle pain, and or treating it so that you can stay active and you're not walking around or being around miserable because of that muscle soreness. All right? Now, there are a few different reasons why you experience that muscle soreness. We'll talk about different time, different date. Today we're just talking about treatments. Okay? Now, the number one treatment that we've found because of the reasons for your muscle soreness is easy activity. We want to increase blood flow to the muscles that are sore because that blood flow speeds nutrient delivery, and that nutrient delivery can be in the form of healing bodies, let's say. All right, meaning you're going to deliver new blood flow to the area that's broken down and fix it. Now, what does that mean? It doesn't mean going doing more workouts. It means doing easy activity, going for a walk. Easy movements, such as mobility training. Okay, kind of like what you do in your warm-up. Arm prehab, rehab style exercises where you're just doing easy movements. Okay, just to sort of activate the muscle and create the need for blood flow. All right? Another method that is not most people's favorites, but is very, very good, is an ice bath. Dunking into a cold bath of water for 15 minutes can have many beneficial reasons, or many beneficial things associated with it. And that's why you'll see a lot of professional athletes will withstand and endure sitting in an ice bath for 10 to 15 minutes. It has many good properties for it, okay? So if you can do it, definitely get bag of ice, 10-pound, 5-pound bag of ice, dump it into your bath, run cold water, sit in there for 10 to 15 minutes. You'll feel amazing afterwards. Not during, not so much. It is a little bit pins and needles tingling. However, if you've ever experienced being in an ice bath, you'll know how you feel afterwards. Highly recommend. Okay? P&F stretching. Proprioceptive neuromuscular facilitation. Using the muscle's natural desire to contract or natural propensity to contract and relax and then be able to move farther helps to speed the process of recovery. So P&F stretching, if you know a P&F stretching specialist in your area, highly recommend going to them to help with stretching. Static stretching can help. Dynamic movement, which we already talked about, can help. P&F stretching is another method that is actually, in our opinion, the best of the options available other than ice bath, because it simply allows the muscles to relax, contract, contract, relax, which does help speed that blood flow. So an example of a P&F stretch might be something that's better with a specialist who does it for you versus just yourself. But if I pull on my neck very gently, I'll get a stretch right here. I'll hold this for about 3 seconds, 1, 2, 3. I'll then try to push my neck back that way, which will cause this muscle to contract. 2, 3, and relax. I can now go even farther because of what our proprioceptors are doing. One of them will actually contract the muscle as a safe defense mechanism. One of them will inhibit that contraction, and you can now contract or move farther. That's P&F stretching. Foam rolling is also amazing. So you've probably seen those foam rollers rolling on those appropriately, meaning not to see how much pain you can endure. A lot of times you'll see people really in pain while they're doing them. That's not the purpose. You want to get just a little bit of pressure onto the layer known as fascia to then expand and allow that to relax. It gets a little bound up, and then we're just trying to get it to relax and open up, allowing the muscle to move freer, so to speak. All right? Using lacrosse balls is also a more specific point, trigger point as it's typically called in our industry. Very specific point of foam rolling, let's say. All right? Massage. If you have a massage therapist available and or you can get in to see a massage therapist wherever, it is very beneficial. First, while you're getting the massage, you're going to be relaxed. Just in and of itself, relaxing is very good. So that means meditation is actually very good for you as well. Because sometimes we're just so hyped up, so tense, we can't just... Okay? So massage and getting the problem areas worked on. Okay, so you can go to say, hey, just a lower body or just an upper body, or really focus on my shoulders. If you're an overhead hitter or overhead thrower like in softball or baseball, getting the rotator cuff muscles might be very beneficial. If you're a hitter, rotational power, your obliques and your hips, such as softball, baseball, tennis, getting your hips worked on and lower back worked on would be very beneficial. Okay, so massage is definitely something we recommend. And then sleep, okay? Sleep is very beneficial for allowing our body to just relax and allow that recovery process to happen. Sleep allows our recovery, where we are focused on recovery or repair, is when our body starts to just kind of fix itself. That's why, let's say at night, you notice they do a lot of road work at night. Think of your body and your muscles as roads. They'll do a lot of the road work at night because there's not a lot of traffic, meaning activity, all right? So while you're sleeping, all those roads are getting fixed, all right? Those are our favorite methods right there. So what did we cover? All right, active recovery, just go be active in an easy, light manner. Ice bath, if you can tolerate it, which honestly you can. It's not gonna be your favorite, but it's gonna be amazing. P&F stretching is amazing, okay? We highly recommend finding someone who can do P&F stretching. And if you're not sure who that is, we actually have a course that teaches parents and coaches how to use P&F stretching for their athletes. Okay, it's actually easy to do course. It's just you have to understand the concept of what P&F is. So we have a course on that. And then active movement, stuff like pre-warm-up stuff, prehab as it's typically called, massage and sleep. All of those are amazing. You can do any combination. We recommend doing them all a little bit. And you'll notice that as you're very deep into the season and deep into your training protocols, your body's gonna withstand and hold up better, actually feel better, and that generally will increase your performance, because if you're sore and in pain, you're not gonna be performing at your best. Okay, lastly, sometimes the best answer for being sore and in pain is shutting it down. Okay, we never really want to get to that point, which means you probably should have addressed the issue before that, but sometimes the only answer is you need to shut it down for a couple days, couple weeks, maybe even a month. But hopefully we never get to that point. All right, that's all I have for today. This is our lesson on our favorite methods for for recovery to help alleviate some of the muscle soreness and pains that go with being active. All right, I'm Spencer Aiken, Stronger Together Performance Academy. Thank you guys very much.